Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Doug Iliff of Topeka about finding the right physician. Thanks for being here today, Doctor.
You're welcome, Amy.
Now, say I am new to the community or my insurance changes, how might I go about finding a new doctor?
Well, you may not have much choice depending upon your age and your health condition and what insurance you have, but assuming that you do, the best place to find a new physician would be talking to a trusted friend who knows your personality. Don't go to the yellow pages. The thing you need to remember is that doctors are just normal people. We've got the whole range of personalities and quirks, and we're not selected like dentists for our bedside manner. And so it's important to find the right fit, and that may be difficult.
What is the most important thing to look for when looking for a new doctor?
Well, the most important thing is competence and conscientiousness. However, patients can't judge that from the outside. Furthermore, you can't figure it out by going to Angie's List or on the internet. The best thing is to find yourself settled in with a primary care physician who really knows you well and that you've liked and trusted, and they'll steer you to the right physician. Another source would be nurses. Nurses are well attuned to the medical community, and it's hard for bad apples to escape very long without everyone knowing it.
Everyone talks about bedside manner. How do you measure that?
Well, it's one of those things, unfortunately, that is impossible to define, but we know what it is when we see it. I think that basically what you're looking for is someone who listens attentively and will answer your questions openly and honestly. You look for kindness, you look for patience, and you look for caring, I think.
Okay. How do you think you develop trust?
Trust is probably the most important factor between a patient and a doctor. I think it takes time and it takes experience. It's something that develops over time as doctors and patients work through a number of problems. Once you've established trust, though, with the physician, the patient will get a whole lot more work done and get better care in a much shorter amount of time.
Okay. Anything else we might need to know?
I think that when it comes to knowing a physician, it's kind of like a marriage or a business. You've got to give it time to develop. The people who don't get good care are the ones who are doctor shoppers, who are hopping from physician to physician. You're never going to get the best out of the medical community if you don't stick with someone and work through the tough things until you know each other well.
Great. Good information. Thanks for being here today, Doctor.
You're welcome.
Please join us next week for a new health topic discussion on House Calls.